Heart failure is one of the most difficult chapters in cardiology because it is a clinical syndrome and it's not a single pathological diagnosis. So we need to educate patients how to realize what is going wrong with their heart, and the early signs of heart failure are usually shortness of breath, ankle swelling, and fatigue. This means that they feel weak, tired during their everyday activities, which used to be completed easily in the past. This usually happens gradually, and the patients notice these main symptoms that I just said over a few weeks or months. And there are some other signs which are early signs, but the patient might be unable to recognize, therefore he needs an examination by the doctor. This can be engorged, big neck veins, some, as we call it, pulmonary crackles, but you need to listen to the chest of the patient. These are the main symptoms. I think that the symptoms that I described should guide the patient to go to the doctor. Of course, there are other diseases that can cause these kind of symptoms. So it is very important to differentiate early the diagnosis and to make the proper diagnosis of heart failure. So a specialist is the best option, but of course the first access is the GP. The cardiologists are more specialists and they can easily guide the patient to do simple tests like an echocardiogram, which is a cornerstone of diagnosis of heart failure. So it is a puzzle and we have to put all the pieces together. After the patient recognizes these symptoms, he should seek for medical attention. So a cardiologist can examine first of all the patient, take a proper history, which can make up the 70% of the diagnosis, and go ahead with some important imaging modalities. The simplest one is the echocardiogram, which is the ultrasound of the heart. It's a simple scan, no radiation, easily accessible, and can give a lot of information and make the diagnosis. If we need to do more things, then we can go ahead with other modalities. But as I said, these are the most important things. If we understand what the cause of the heart failure is, then we can implement the proper treatment. So, for example, if a patient has heart artery disease with a previous heart attack and he needs some intervention, then the treatment is different from a patient who had myocarditis, which is very common nowadays after the COVID pandemic, and or hypertension, which is high blood pressure, of course. So the two most common causes of heart failure are hypertension, high blood pressure, and coronary artery disease, which is blocked arteries of the heart. So by understanding these, we can implement the medical treatment, which is the first arm of treatment. And then there are some other invasive treatments, as I said earlier, in the case of coronary artery disease, where the patient might need balloon or stent implantation in the coronary arteries. The prognosis of heart failure depends, again, on the etiology. So myocarditis, which is an inflammation of the heart's muscle, has a very good outcome in general. So we usually see young patients who might be diagnosed with these kinds of heart failure, and with early treatment, they can have a complete recovery. In more elderly patients who had been left with untreated hypertension, untreated coronary artery disease, then if the damage on the heart muscle is irreversible, then the prognosis is not good at all. So in general, heart failure, if it is not treated properly, the prognosis is very poor, and it is worse in the later stages, the late stages, than cancer. So we need to focus on early identification of patients with heart failure, implement treatment quite quickly, and this will improve the outcome and the prognosis. Heart failure is a chronic condition, and depending again on the etiology, might need treatment for a short while, or in the majority of cases, it is a lifelong treatment. So in some cases of myocarditis or heart failure after delivery in women, which we call it postpartum cardiomyopathy, this can have a good outcome, and we can start proper treatment with drugs, and after a few years, the patient might stop them and have a normal life as by doing different echocardiograms, cardiac MRIs. If the heart has fully recovered, then we might be able to stop the drugs. But in most cases, I'm afraid we have to treat the patient lifelong. The heart failure can be prevented by preventing the cause of heart failure. So, as I said earlier, hypertension is one of the most common causes, and therefore, by implementing healthy lifestyle, which includes healthy diet, regular exercise, monitoring our weight, is very important. The other cause of heart failure, as I said earlier, is the coronary artery disease, and this can be prevented with lifestyle modification again. So the great majority of heart failure patients can be prevented by implementing a healthy lifestyle from young age. So I think we need to educate in the primary practice people how to have a healthy lifestyle in order to prevent some conditions which will progress to heart failure. Now, there are some conditions like myocarditis which might not be easy to prevent after a viral infection or after, for example, cancer treatment. In this case, I'm afraid that the patient cannot do much to prevent this, so we need to treat them properly, and this depends on the doctors, the specialists. There are some other hereditary cardiomyopathies, and again, the patient cannot do much for this, but in most cases, as long as we diagnose a patient with heart failure due to these conditions, we need to screen the whole family, and this depends on the healthcare system to act properly and prevent these conditions in the members of family and prevent the progression of heart failure in the future. So in conclusion, I would say partly depends on the healthcare system and partly depends on the patients themselves for primary prevention.